Hello, and welcome to Health Professions Week. I'm Dr. Sharon Glennen from Towson University, and I'm here today to tell you about my career as a speech-language pathologist. I selected this profession when I was in high school by browsing through lists of majors at the colleges that I wanted to attend. I knew that I liked to talk, and I knew that I liked children, but otherwise I really had no idea what a speech-language pathologist did. I filled out my college applications with speech-language pathology listed as my major, but really I was pretty clueless about what my future was going to be. So my first advice to students who are watching this talk is to put more thought into choosing your future career than I did. I still think I ended up in the right profession, but it happened out of dumb luck, and hopefully you'll do better. So why should you consider becoming a speech-language pathologist? Well, what most people don't realize is that there are lots of different career paths for people in our profession. One of the things I love about being a speech-language pathologist is the variety of clients and disorders we work with. We are communication and swallowing specialists, and that covers a lot of territory. I always say that we see people from birth all the way to death. Speech-language pathologists work in neonatal intensive care units, teaching parents how to feed teeny tiny preemies. We see toddlers with Down syndrome or autism in their homes, teaching their parents how to help them say first words or communicate with sign language. We work in children's hospitals, helping children with cancer or brain injury learn to talk again. And we're embedded in schools, seeing children from preschool through high school. School speech-language pathologists might help middle school children who stutter, teach a first grader how to make words with R sounds, program computer tablets that serve as talking communication systems for a high school student with cerebral palsy, or help a preschooler with autism learn social interaction skills with friends. We also work with adults in a variety of settings. Speech-language pathologists in hospitals might work on a team of professionals helping adults with Parkinson's disease learn how to communicate more clearly, or helping adults with head and neck cancer learn to eat again. Some of us even work with singers, teaching them how to sing without damaging their voices. We work in rehabilitation centers, helping grandparents who had strokes relearn how to talk and swallow. And we work in nursing homes, helping elders with dementia learn how to work around their memory deficits. And sometimes we help clients communicate with loved ones, even through their final days. When I first started, I had no idea that speech-language pathologists worked in all of these different settings and with such a wide variety of different kinds of people. That variety is what kept me happy in this profession. Throughout my career, whenever I get bored with what I'm doing, I'm able to reinvent myself and head off in new directions. My first job had a lot of variety. I worked 2 days a week as a home health speech-language pathologist, seeing adults for post-hospital care in their homes, and 3 days a week in a classroom of children with autism and cerebral palsy who couldn't talk. The children who couldn't talk just fascinated me. I cheered every word I was able to teach them, and I got frustrated when some of the children didn't make progress. That frustration led me back to school for a doctoral degree in my field. My research investigated better ways to help children with severe disabilities learn to communicate. During my doctoral degree, I became highly specialized, and I only worked with children with autism and cerebral palsy who were unable to talk. When I finished, I took a job where I worked full-time with that population in a large children's hospital. I kept up my research and became a nationally known expert in that area of our field. However, I was also the director of the hospital's speech-language pathology department, and I would sometimes see other types of cases. I started to see a lot of children with a neurological disorder called ataxia, and I began learning as much as I could to help them communicate. In time, that developed into a brand new specialty for me. About every 5 to 10 years, I get the itch to do something different with my career. A particular case or an article sparks my interest in a brand new clinical area, and I start to learn as much as I can. I request those types of clients, and in time, I become a specialist in a new area. This reinvention has kept me fresh in my field and helped prevent burnout. When I was director of speech-language pathology at the large children's hospital, I had a staff of 40 speech-language pathologists working in my department. New SLPs were hired to fill specific positions. But when openings occurred, I encouraged my staff to shift into new positions so they could refresh and try something new too. Even though I've been in this profession for 30 years, I'm still reinventing what I do as a speech-language pathologist. A few years ago, a personal connection got me interested in internationally adopted children. Their experiences learning a new language after adoption are fascinating. I quickly realized that we didn't know much about how these children change languages, and that led to a brand new research interest. Some of the internationally adopted children I worked with as babies had trouble learning to read and write when they started school. So I began learning more about literacy and its relationship to spoken language, and that opened another new interest in my field. Over the years, my interests have constantly changed. I went through periods of being a generalist, seeing a wide variety of clients, and periods of being a specialist who only saw clients with a particular disorder. Whenever I get bored with what I'm doing, I seek out something new. Now I teach at Towson University, and I get to guide future speech-language pathologists into our profession. I always advise them to find something in our field that sparks joy. If you can find a profession that sparks your joy, that keeps you challenged, that has opportunities for reinvention, and lets you help people at the same time, there's nothing better. I found speech-language pathology by accident, and I'm so glad that I did.